Universal healthcare is a concept where all the citizens and residents within a country have access to the healthcare that they need at the point of their need, so that it's not based on ability to pay, but it's actually based on health needs. So everyone who needs healthcare can get it. You can argue about that there is a moral reason for there to be universal healthcare based on the common concept of humanity. But from a social cohesion perspective, if you want a society that's vibrant and that works together, then you have to make sure that you have systems in place to take care of the health of everyone in the population. And then, particularly as a public health doctor, there is the public health question, which is that universal access to healthcare ensures that you're able to protect the health of the population. So, for instance, if there is an outbreak of an infectious disease, say like tuberculosis or swine flu, as we had a few years ago, universal access to healthcare means that as public health doctors, we know that we can really go out into the community and find the people who have these problems, trace their contacts, and know that they can be treated and that we can contain that disease. Where you don't have universal access to healthcare, you then have problems picking up some of the cases, the contacts. You don't really know who's got it, who hasn't, and that poses problems for public health. Going back to my point about universal access to healthcare and the benefits, I think migrants are part of the society in the UK, and therefore the NHS, for us to be able to discharge our duties in relation to protecting the health of the public and in relation to reducing health inequalities, needs to be able to ensure access for everyone, and that includes migrants. And I think, there is such a broad range of who's a migrant, that you can't say migrants should have access, as opposed to everyone really should have access to the National Health Service. That was why it was set up. That was the dream of the founding fathers of the NHS. I think it's brought several benefits. If you look at some of the population health outcomes, so if you look at what has happened to the health of people in the UK pre-1948, when the NHS came into being, and subsequently, you will see that there have been a number of remarkable achievements, both in terms of improvement in health. So things like infectious diseases that I mentioned are a lot less common. We have immunization programs that cover the whole community. We have screening programs that cover the whole community, and those have all led to improvements in the health of people. And I think it also contributes something to social cohesion, the fact that people feel a sense of solidarity. The NHS is one of the most valued and loved institutions in Britain, because everyone feels that it is there for them when they need it. And I think that's been very important. And I think as global migration occurs and there is increasing diversity, it's important that those sorts of institutions that hold people together are maintained and strengthened.